Thank you, Isabel, and thank you everyone for joining this evening. I'd like to share my discussion on endometriosis. Endometriosis is something that a large majority of women suffer from and very few diagnosed with. Sorry, give me a second. There we go. So the objectives today at the end of this discussion is one, really to understand and define the disease, the symptoms, and the treatment, to understand how to thrive with the disease, and how to seek help if you believe you have the disease. So what is endometriosis? Endometriosis gets its name from the inner lining of the uterus called the endometrium. And when the lining of this uterus, the otherwise known as the endometrium, and the glands that exist there, when those tissues are outside of the uterus, this is considered endometriosis. There are a couple of places that we usually find endometrial implants, that being the outer surface of the uterus, sometimes on the fallopian tubes, and most often on the ovary. There are a few occasions where you can see endometrial implants on a bladder, being that the bladder sits in front of the uterus. And there are sometimes that endometrial implants can be seen on the small intestines as well, which sit directly behind the uterus. What causes endometrial glands to be outside of the uterus? The real answer to that is no one knows. However, there are a few different thoughts about how this may happen. One is considered retrograde menstruation. This is when bleeding backflows outside of the fallopian tube and into and onto other organs. Some people have the thought that this is hematologic or lymphatic spread. So these glands could spread through different blood vessels or lymphatic vessels to other areas in the body. Coelomic metaplasia is the thought that cells just turn into different type of cells in different places. And genetic factors. We do know that moms that have endometriosis sometimes have daughters, sisters, cousins that also have endometriosis. What those genetic factors are still unknown. And could it be all four? Possibly. So what are some of the symptoms of endometriosis? Well, one is pain. That's probably the number one symptom of endometriosis. I know that young women think that having menstrual cramps is common and normal, but excessive pain is never normal in a woman's menstrual cycle. Lots of women that suffer from endometriosis wind up in the emergency room seeking narcotics because they're in pain. This leads to decreased days at work and/or school. Painful urination or painful bowel movements. Again, as I mentioned previously, since endometrial implants can be on the bladder or on the bowel, you may have symptoms associated with both of them. Diarrhea or constipation included if these are located on your small intestines. Abnormal or heavy menstrual flow. Many women who suffer from endometriosis not only suffer from painful cramps, but they suffer from heavy bleeding as well. Because the endometrial implants that are associated with this disease can be located on your fallopian tubes, this is a number one reason that many women suffer from infertility, just scarred fallopian tubes. Pain during intercourse. Again, the endometrial implants sometimes create scarring, which I'll show a picture of in a few. And when this scarring happens, it creates a situation where different organs in the pelvis sometimes get stuck together. And if the intestines can't move, if the uterus or the cervix cannot move, this presents pain during intercourse. And when these endometrial implants are on the ovary, they also sometimes develop into cysts. This also can lead to painful intercourse as well. Vaginal bleeding between periods. Again, this is an infrequent symptom of endometriosis, and just fatigue. Usually signs of endometriosis happen even before the menstrual cycle starts. So several days before the cycle starts, women start to suffer from pain. Having pain 4 or 5 days before the cycle, having pain throughout your cycle, having heavy periods, yes, that can cause lots of depression and fatigue. So this is what endometrial implants look like if you were to go in and look at a woman's abdomen. These are actually considered big implants because sometimes you can barely see them. If you look at this picture here, this shows you there's not an ultrasound, CT scan, or MRI that can definitely tell you at all times whether you have endometriosis. These implants are extremely small. And it is not how many implants you have that causes the most amount of symptoms. Sometimes just these few implants alone that look like they're probably on someone's bladder here in this picture, this could cause severe pain, whereas many implants can cause no pain at all. But this is just a picture to show you what we see inside a woman's pelvis. As I said before, when you have these small implants, endometrial implants on the outside of the uterus, whether they're on the fallopian tube or ovary, they can cause lots of scarring. When scarring occurs, this distorts the fallopian tube and can severely block it, causing infertility. If this was the case of the intestines having scar tissue to the uterus, again, this can cause a lot of pain, even upon movement, intercourse, and of course, during the menstrual cycle. So no matter where these implants are, they can cause lots of scarring. I can say that I once heard, and there was an article about a young woman who usually had lots of nosebleeds during her menstrual cycle. No one could understand why. This woman had endometrial implants, unfortunately, in her nose. That's how far distant endometrial implants can occur. I can say that 90% of the time they are located in the pelvis, but they can involve any organ. So how do we diagnose? History and physical are going to be the mainstay. Again, as I said, menstrual cramps are not normal. Severe menstrual pain is not normal. And many women live with pain throughout their cycle and think, oh, this is what they must mean about having menstrual cramps. When a simple Motrin does not get rid of your menstrual cramps, this is outside of what we consider common and normal. So any woman that tells me that they have missed days from work or school, that have been to the emergency room seeking pain management, that heating pads and Motrin don't take care of their pain, it's endometriosis until proven otherwise. When a woman tells me that they have tried to get pregnant, that they've had painful menstrual periods and irregular periods, to me, it's endometriosis until proven otherwise. When a woman has severe diarrhea, painful urine without evidence of a urinary tract infection, and pain during intercourse, it is endometriosis until proven otherwise. On physical exam, when I touch a woman's cervix and it elicits pain outside of an infection, it is endometriosis until proven otherwise. If I see blue spots in a woman's vagina, it's endometriosis until proven otherwise. And if I touch a woman's uterus with no history of fibroids, it's endometriosis until proven otherwise. And ovarian cysts that are filled with blood are endometriosis, endometriomas until proven otherwise. History and physical alone can diagnose endometriosis. Do not be afraid to speak in depth about your experiences within your menstrual cycle to your physician. When endometriosis is suspected, a physician may elicit to do a pelvic ultrasound. Usually what they're looking for are endometriomas, or what we call sometimes chocolate cysts, but they're just cysts filled with blood created by a ball of different endometrial tissues. This could be evidence of endometriosis. Otherwise, on pelvic ultrasound, those small implants that I showed you would not show up. CAT scan and MRI sometimes also can give you evidence that there may be endometriosis. Again, looking for endometriomas on the ovary that not every woman has is mainstay, but really won't give you too much evidence. Surgery can also diagnose. There's many times during a routine cesarean section or a routine surgery to remove an ovarian cyst where endometriosis is also diagnosed. So what is the treatment? Treatment sort of eludes us at this point, because the number one issue with endometriosis is that it produces pain. So most of the time, treatment is geared towards taking care of painful menstruation. And we start with NSAIDs, whether that be Aleve, Motrin. Sometimes this can help. But other times, women do wind up in the emergency room seeking narcotics because the pain is that severe. When a patient's pain is not controlled with NSAIDs alone, and frequent trips to the emergency room are occurring, the one thing that we want to do is now give hormonal treatment. Hormonal treatment usually begins with birth control. Birth control is designed to decrease heavy bleeding. By decreasing heavy bleeding, the goal is to decrease some of the pain associated with endometriosis. In addition, there's many different birth control options that are geared to having a woman stop her menstrual cycle. By stopping the menstrual cycle, again, we're limiting the bleeding, thus limiting the pain. Whether it's a extended cycle pill that allows you to have a period every 3 months, or whether it is a progesterone-only contraceptive, that being the IM injection every 3 months, the progesterone-only hormonal implant that is good for 5 years, or even an IUD, a hormonal IUD that's good for up to 7 years, that will stop the cycle, the menstrual cycle for women. GnRH agonists are temporary measures. These are hormones that are going to stop the hormonal pathway from the ovarian hormones from producing LH and FSH. I say these are temporary because long-term use can have side effects such as male pattern baldness, deepening of the voice, and elevated testosterone levels. But these can be used for short periods of time. Orlissa is a medication, it's a GnRH antagonist that is now on many commercials for the use for patients with endometriosis. Surgery could also be done. The small implants that you saw sometimes could have electrocautery. If it is located on the intestines or even on the bladder wall, that's not where you want to do electrocautery. Removing endometriomas are conservative surgical management as well. And for those that have heavy periods and are done with childbearing, a uterine ablation can be done to burn the inside of the uterus to avoid any further bleeding. There's only one treatment that is a definite where endometriosis will be stopped, and that is more or less a female castration in removing the ovaries. This is never a surgery that is first and foremost, especially in young women, nor is it in middle-aged women. We know that ovaries have good estrogen and heart protection. So alone doing a hysterectomy is not going to cure endometriosis. It will stop heavy bleeding, but it will not stop painful menstrual cycles because this comes from the hormones of the ovaries. And no matter where those implants, those endometrial implants are, they will still react to the hormones given off by those ovaries. So a hysterectomy alone will not take care of endometriosis. So how can endometriosis affect daily life? As I've stated before, severe pain, decreasing absence from work and school, as you see here, infertility, depression, anxiety. It is very painful for a woman, not only physical pain, but explaining to physicians, especially non-gynecologists, that you're having severe pain. Some are seen as drug seeking, and some people just don't understand what endometriosis is or the pathogenesis of it. And it's the last thing that they think about when it should be the first thing. So what is endometriosis? This is a good slide from the Endometriosis Foundation of America, which really prints out the common symptoms. And it actually tells us about the crisis in detail. Sometimes, as I've said, it is painstaking for women to finally get a diagnosis of endometriosis. It can take 8 to 10 years for a diagnosis in some women, a diagnosis that starts at the age of menarche. Sometimes there's 2 to 3 times higher risk in close relatives. As I've said, it may have a genetic component. 10 hours a week in lost productivity when patients have to stay home, which includes $119 billion annual US economic loss when women are staying home from work dealing with pain. And this also includes a 30 to 50% infertility rate for those that have endometriosis. There are different stages of endometriosis. Stage 1 are minimal implants, where stage 2, there's more. Stage 3 and stage 4 include implants and scarring in the pelvis. As we discussed, hormonal birth controls and surgery are part of the treatment. So what are some of the myths? Hysterectomy is a cure. That's a lie. Missing school or work due to pain is normal, never normal. The level of pain relates to the stage of the disease. That's not true. Sometimes people with stage 4 disease have minimal symptoms. So there is a societal stigma against women, as there always is, especially when it relates to their menstrual cycle. And there's a severe lack of funding, research, awareness, and diagnostic methods for this disease. Women are usually forced into a culture of silence about their menstrual cycles and their bodies. And I offer to you and anyone listening that if you have severe pain, if you have pain on intercourse, if something doesn't feel right, speak about it. And many doctors are just misinformed. Women's health is considered taboo. Women don't usually come into the gynecology office talking about their sexual habits, about their menstrual cycles. It is not until some physicians actually ask patients, do you open up Pandora's box? Because they sit there in silence thinking it's normal. And sometimes they sit amongst a bunch of friends who also think it's normal, not knowing they're suffering together. So are we surviving? Are we just thriving with endometriosis? How do we thrive with endometriosis? Well, one, there are thoughts that maybe you should watch diet and increase fruits and vegetables and increase omega-3 in your diet as well. Exercise is always going to be mainstay for any disease. Managing stress, whether it's yoga, whether it's exercise you do that with, managing stress is also important in disease development. And then there are some alternate therapies like acupuncture that can help manage all of the above. There are lots of support groups out there. And now with increasing groups on the internet, on Facebook and Instagram, there are many women out there that lend support to others with endometriosis. The Endometriosis Association is the first organization in the world that was created for women with endometriosis, and it's dedicated to education, support, and research. There's a worldwide endometriosis march called the Endo March, and this organization aims to raise awareness, advocate, and improve care for women with endometriosis. And every year on the last Saturday of March, the worldwide Endo March calls to action to raise awareness for endometriosis. Speak Endo. Using this hashtag can help you continue speaking up about endometriosis on social media. Tag your own posts or just follow to hear other women's stories and learn how they're advocating for better care. And My Endometriosis Team, a social network dedicated to connecting women with endometriosis. They can ask questions, share support, and make lasting connections. I know that one of my close friends joined all 4 of these organizations way before I started talking about endometriosis. And it wasn't until she joined that she asked me, knowing that I was a gynecologist, did you know about these support groups? And I actually didn't. But it made her life better. It made her seek out alternative therapies. And it made her feel heard, that there were other women similar to her dealing with the same diagnosis. So how do you prepare for your next appointment if you think you're suffering, and even if you're not? When you come to the gynecologist, I would say, make a list of any symptoms you're experiencing. Include them all, even if you don't think they're related. Make a list of any and all medications, herbs, or vitamin supplements that you take. I don't know how many times I have taken some of the older family members in my family and personally written down their medication and put it in their wallet. This is so important, not only when you go to the doctor's office, but also in case of an emergency, someone needs to know what the medications that you're taking. Have a family member or close friend accompany you if possible when you go to the doctor. Sometimes when you're hearing information, whether it be positive and negative, it goes in one ear and out the other. And after the first 5 minutes of hearing any type of diagnosis, patients usually shut down. You need an advocate with you, whether that be your partner, your mom, or your friend. But I always advocate, never go to a physician's office alone. Take a notepad or electronic device with you if you don't have that option. That way you can record everything and play it back, because you're never going to remember everything. Prepare a list of questions for your doctor. List your most important questions first to make sure that you address all of those points. This concludes my talk on endometriosis.
Thank you so much. I'm going to actually send the links that I had mentioned before in order to join the Thrive group. And I'll just give them a minute to type in some questions. One of them already came up.
You want me to address those? I see a question.
I could. I'm just waiting to see if anybody
Okay.
else will go.
No
But we
problem.
could go. So is there any specific type of foods that could flare up or affect endometriosis? For example, coffee.
I haven't heard anything about caffeine specifically. I would say foods, rich fatty foods, fried foods can cause a flare up. Those that also suffer from Crohn's disease, you want to be careful what they have, because anything that's going to affect the bowel could also affect the endometrial implants that may or may not be there. As far as caffeine specifically, haven't heard anything, but it's always a good idea to decrease. There are some benefits to caffeine, and then there are some serious side effects for over caffeinating. So I would say there's moderation in everything that you do. And if you really do need that caffeinated cup, I would just limit it to one cup of caffeine a day. But it's not just the coffee that you drink, whether it be sodas, whether it be some of the sugary drinks like iced tea, chocolates, all those are also caffeinated as well. So you want to be careful about the caffeine intake that you have just on health alone.
Okay, next question. Does IVF treatment with the specific drugs have any negative effects?
Some women with endometriosis do have to resort to IVF, which is in vitro fertilization, just because of the scarred tubes. So there's no effect on doing IVF if you have endometriosis, but what I would say is if we know that there are scarred tubes, if it's only because of endometriosis, it does not have an effect. But if scarred tubes are there because of previous infection, sometimes it's a good idea to remove the tubes completely before you even start IVF.
And last question, if you had them surgically removed, is there any way for them to come back?
Absolutely. So this is why there's not really a cure. As long as those ovaries are there, endometrial implants can occur at any point in time. Again, whether it's the retrograde menstruation, whether it's what we call coelomic metaplasia or lymphatic or hematologic spread, the way they got there, they can get there again. So surgery is usually the last resort and not usually something that is done for patients with endometriosis unless it's affecting other organs.
Okay, and last question, does birth control slow down the process of endometriosis?
Birth control will shut down the hormonal pathway. So what it will do is, one, limit the amount of menstruation. So if you decrease the bleeding, hopefully we're also seeing signs of decreasing the pain. And yes, we hope that it decreases the spread of the endometrial implants as well. GnRH agonists and antagonists are a little better at that than birth control alone. But for some women, the pain alone and the bleeding is stopped with birth control.
Thank you